In the past 2 decades, Ethiopia has made considerable achievements in child and maternal health. However, substantial room exists for improving both maternal and childhood morbidity and mortality. Evidence-informed public health practice plays a significant role in drawing appropriate policies and introducing cost-effective programs that help efforts in improving maternal and child health. Unfortunately, decision makers and researchers inhabit different worlds. While decision makers want evidence that is relevant and easy to understand, researchers may revere theories and concepts. In most cases, research being conducted may not necessarily be in priority areas of the health sector and can be inadequate and irrelevant as well. Research gaps in specific health program areas can bring rise to issues such as lack of funding, lack of interest, and incomplete information.
Globally, as well as also here in Ethiopia, there is an evidence for a widening gap or an existing gap between academics and the program people, particularly in health system. What it means is they are sort of running their business in parallel without much of contact, or much of interaction. So the academics do their research separately, independently, identify their own question, get resources for the research, and go through all the processes and finally publish it on, scientific journals, and that's it. On the other hand, the programmers have their routines. They follow their own tradition, their own structure, and so on. But in reality, they should have worked together. Whatever science is producing should, at the end of the day, should be translated into practice.
In addition, research results may not also be accessible to health managers and policymakers, as publications are usually published in journals abroad or in local journals have limited distribution to selected circles. Even if they manage to access the research publications, the reporting of findings is not in a format ready for interpretation and used by health policymakers or managers. Further, decision makers want answers quickly, but researchers often take years to complete their respective studies. As a result, both decision makers and researchers fail to exploit the opportunity of improved health outcomes, accurate to synthesis, translation, transfer, and implementation of health research evidence. As such, it's crucial to set up a knowledge translation platform through the support of intermediaries or brokers who are positioned at the interface between the worlds of researchers and decision makers.
What we did, particularly what Fenot tried to do is, to try to to fill this gap, the gap that I already mentioned between the researcher and the programmer people, particularly in the area of health. So we sort of call ourselves as brokers of knowledge. So what we actually do is bring these two entities together, or create the opportunity for these two entities to work together, to collaborate in terms of using evidence for public health practice.
For the RAC, one thing is we provide technical support. The Fenot team provide technical support. We have different approaches to make sure that the evidence synthesized and packaged by the Research Advisory Council actually reaches the target group, the policymakers.
The RAC has proved to be instrumental in bridging the divide between those who produce evidence and those who are expected to use it. Transferring research evidence into healthcare policy and practice results in reduced health inequities and waste resource. One good example is RAC's provision of evidence that introducing a birth dose of hepatitis B virus vaccine in Ethiopia would likely be highly cost-effective, with investment of $110 per daily averted. The Ministry of Health would like to commend RAC for providing this invaluable evidence and Fenot for facilitating RAC's activities. It also calls upon development partners to work with the Ministry of Health in scaling up such a cost-effective and life-saving intervention.